if you accept my thesis that the most advanced aspect of our brain function is this remarkable capability that we've developed as a species to commune and organize ourselves, to communicate with each other, and to have that shared affiliation that is our modern culture, the biggest challenge that we have in rehabilitating wounded veterans is to get them back into that community and get them affiliated with and involved in activities, organizations that define modern life. And sometimes they isolate, sometimes the disabilities themselves make them not want to participate. They may be depressed, they may be anxious, they may be socially avoidant for a variety of reasons. There may be issues of cosmetic changes after injury that make people shy away from social involvement. But that social engagement, I think, is the most important part of treatment. Once you get past the point of being a patient in the ICU and you've survived your injury, what's really going to define quality of life for you is the degree to which you can return to community and engage in everyday living activities that we all take for granted. And often that doesn't happen. So I am trying to define a broader role for the healthcare system from the military treatment continuum to go into communities and mediate success in those environments. We need to get doctors and therapists out of hospitals and into people's neighborhoods, into their kitchens, and into their social environments, and look at how we can support success in those environments. Beyond the patients, I think we need to articulate to the nation the importance of doing this, to get people engaged, to help people do whatever they can do to support families of wounded warriors and wounded warriors themselves to rehabilitate and re-engage in everyday living. That mission change is conceptually very challenging. I mean, I go to meetings with other doctors who work with broken arms and legs and do surgery, and I talk about this aspect of treatment, this long-term trajectory, and what success in the community looks like. And I can get the deer in the headlights stare back, and people are sort of, that's not really medicine. They're thinking, I understand what you're articulating, but it doesn't really seem that it fits the vision of doctors prescribing pills and patients coming to hospital to get surgery. But if you accept that the human brain, that remarkable organ, is the organ that mediates success in those social endeavors, and you accept that injury to the brain on the battlefield corrupts competence in those areas, why shouldn't we support that? That should be part of what a vision of medicine is. So when I think about redefining the future, it is largely a philosophical or paradigm shift for clinicians to think beyond hospitals and think about how those disabilities look in everyday life, and then think about what do we need in terms of assets, what types of skills do we need therapists to develop, where do we need to deploy those therapists, how can we support our wounded who are going to have 40, 50, 60 years of community living derivative of this conflict. And as I said, the numbers are in the hundreds of thousands. So that's the challenge, and part of the way that I've tried to negotiate that challenge is to talk to people who are not doctors, talk to families, talk to the media, and promote public awareness to think about the challenge. It would be a little bit like if an analogous disability, like let's say Alzheimer's disease didn't exist, and then all of a sudden we had a flu epidemic that infected the brain, and we had 1 million people in this country with Alzheimer's disease. There are all kinds of accommodations that we've made as a society to successfully meet the challenge of Alzheimer's disease. We have special living environments, we have special services, we have economic accommodations, and so on. We need to be smart about a portfolio of accommodations and modifications to our society to support wounded warriors who have got damage to this most advanced of organs, the brain, and that affects their ability to be viable or successful or happy in a community environment away from the hospital and doctors and therapists. That's the challenge. And I think the first part of doing that is to start a dialogue about it and get people talking about it, to break down that sort of intransigence in the healthcare system to think beyond hospitals. And I'm hopeful that with new VA leadership, we'll see the VA start to think anew about its role and its mission, because the long-term legacy of care for those individuals is going to fall squarely into the lap of the VA.